So we're moving on to lecture 2 on neglect and cruelty in imaging. Last lecture we went through a little bit about our role of a radiologist in these cases and imaging features of different types of abuse and neglect that we come across in practice, and what to look for in a radiograph. This lecture is going to actually take all of that knowledge and hopefully apply it to the real life situation, and we're going to talk about decision making in neglect and cruelty cases and give you some case examples. Identifying if an animal has undergone a neglect or abuse relies really on a clinical history of the animal, the physical examination, and the imaging. However, clinical histories can be minimal or inaccurate, and so imaging is often a way to uncover what's happened in the past and to see if the clinical history matches the clinical picture. That's quite important when we're trying to put together what the owner's saying with what we're seeing in the clinical picture and what maybe is being suggested by other parties or has been observed by the authorities. And I'm going to go through a few cases where we're going to have to try and work out whether abuse is present or not, and try and understand that from the imaging that we're seeing. So we're going to start off with case 1 here. This is a 4-month-old black and tan mixed breed small dog. On hospital visit 1, the owner reports pots and pans fell on him and now he's not using his back leg. Clinical exam, toe-touching lameness, swollen, painful left stifle. Outcome, no further diagnostics taken at that stage. Sent home with meloxicam. So that was the first vet visit. 19 days later, owner was a little bit more elaborative about what went on. Roommate threw dog into the wall, now not able to walk and inappetent. So this is a revisit to a hospital. Clinical examination, not wanting to bear weight on either hind limb, marked left thigh muscle atrophy, and we took some radiographs. Okay. So what we have here is a radiographic examination review of the pelvis, femurs. This is a nice straight femoral view. We really like these views, and here we can see on both sides that we have femoral neck fractures in this case. This is the more acute side, where we've got quite sharp edges going on here. And this is the more chronic side, where we've got some proliferative new bone forming at this stage. And this would be probably appropriate for 19 days post-injury, which is what happened in the previous pots and pans incident. And then this is the thrown against the wall injury here. Outcome, bilateral femoral head and neck ostectomy performed and discharged. And at this stage, the ASPCA enforcement team were informed of what had happened. So we've got 2 sites of trauma, 2 different stages of healing, fracture healing, and fairly sketchy histories from owners. Visit 3, which is 22 days later after the thrown against the wall incident. Owner history, not sure what he's doing, but thinks he needs to be seen. So very, very vague. Came into the hospital, clinical examination, pain in distal femur. And we got some radiographs. So after his femoral head and neck excisions, which were done for the previous traumas, we now have a distal femur view. Notice this fragment is very, very close to skin edge. You can't really see that very well because it's not projecting very well, but it is. So it's about 2 millimeters from skin edge. So be a little bit careful. That degree of displacement may be predisposing to an open fracture. But he's got quite a dramatically displaced, probably mildly comminuted, I call this. I think this is a fragment of bone here. So we've got a comminuted distal femoral fracture, an extension through here. Went to the ASPCA and underwent some further evaluation and identified femoral fracture, scleral hemorrhaging, and took some further radiographs. And on these radiographs, we can see that we've got several chronic rib fractures in, I think we can see the fracture line. So in reparative phase, not remodeling phase in these 2. So weeks rather than months at this stage for these rib fractures. And this is rib 9 and 10. So we've got multiple sites of trauma. The summary for this case was between the ages of 4 and 6 months. This dog was sustained 5 broken bones, fracture of the right ribs, 9 and 10, fracture of the left femoral neck, fracture of the right femoral neck, and fracture of the right distal femur. These fractures represent at least 4 blunt force impacts. And so the conclusion of this case, abuse and went down the line of charging these people for their treatment of the animal. The next case is a cat. I don't know if you saw this. This came into Cornell. Cat shot with crossbone dried and officials seek info. So this is a case that happened just in a village down the road from the vet school. This is the history that we got. Cat with arrow in the head reported to SPCA about 2 days, who spent 2 days searching before finding her. Clinical evaluation. Arrow is, they identified an arrow in place extending through the middle and right side of the head. She was lethargic and she had left-sided facial swelling. Neurological examination. She was mildly obtunded. The examination was limited, however, because she was quite distressed and not wanting us to fiddle around with her head and do much with her, although she could walk around. Imaging plan was to do a CT. So this was really helpful for what we were. This is our evaluation of her head trauma with the CT. So we have her nose here, ET tube, and then this is the arrow with the little, guiding things. So as we progress through, we can see the arrow coming down towards her nose here, extending into her nasal cavity at this level. There's a little fracture of the maxilla at this top area, so it's sitting within the dorsal with the nasal cavity here. It then exits. That was that picture I showed you earlier. It exits through the medial orbital wall here. This is her eye. Eye's displaced laterally as a result of it, and there's a few little fractures. It's now sitting right at the base of the orbit here. So we have, if we look at the other side, we have going to have ocular muscles and an optic nerve coming past right there. Narrowly misses her bulla, comes out between her bulla and her mandibular ramus here. And this is her pharynx sitting there. And then we are under bulla. This is a normal bulla here. So sitting in the soft tissues peripheral to the bulla, quite a hot area of maxillary artery and carotid bifurcation at this level. So a little bit close to big vasculature, but clearly she's done well. And you can see the soft tissue swelling that's happened as a result of this. And then this is the arrowhead sitting down in the neck, muscles of the neck here. This is her larynx. And that's her occipital bone. So we're sort of caudal head at that level. This is her on CT reconstruction. So you can see where the head, where it was sitting, it looks, and the tip is probably going to be sitting right in this level here. So coming at this angle here. And really we wanted to know is, can we remove this arrow without causing significant hemorrhage, neurological deficits? And so we did some reconstructions to help show the surgeon exactly where it was lying. So this is her 3D reconstruction, and we can just work through. This is her globe here, her zygomatic arch, then maxilla, teeth. We can slowly go through. CT is brilliant for creating these amazing structures. So we can go through. This is the ramus of her mandible, and then we're starting to see that arrow coming straight through its exact course in relation to nasal cavity. This is her orbit, and running straight through in the soft tissues here. Good thing is this is her brain sitting medially and normal. So that was excellent. So she didn't have neurological deficits. She had that removed. And this is Rachel, one of our final year students who adopted her. So she, I know. Apparently she's very, very friendly and cuddly and a very nice cat, despite having had that happen to her. So she's doing really well.
Question?
Yes?
Do you know which way they pulled it out?
Let me just think how they. I think they trimmed the end and went further through, pushed it through, because the tip of the arrow was sitting still within the soft tissue, so they couldn't retract that. So they took the top off and then they very carefully edged it through. Yeah. So it was really helpful. That CT was really, really useful for identifying that. So she did well. Case 3. So this is a 12-year-old Boston Terrier crossbreed. Owner brought the body of this dog to the veterinary hospital for cremation services after the dog died at home. She had a previous diagnosis of Cushing's and some other chronic diseases, such as couldn't use her pelvic limbs. They think she had some form of thrombus situation going on. It wasn't particularly clear. On an examination of the body, they decided that she was quite underweight. with a thin hair coat, and decided to just do a little bit more probing just to see if there's any other signs of concern. So imaging was performed by the veterinarian. So this is her radiograph, and she has that classic tucked up appearance of that very thin animal, emaciated animal. Loss of serosal detail. This is a post-mortem image, so she's got a big gas. That's classic. Stomach and intestines will blow up with gas at post-mortem, so that's normal. But a very thin body condition, loss of serosal detail. She also has quite thin cortices and quite lucent bones consistently all the way through here. She has a few little sites of spondylosis sitting underneath her spine along here. And notice that she's got a few little fractures of her ribs, one here and one here and one here. So that's already jumping out. Looking at the image here, we have some fractures of her transverse processes of her lumbar spine. It's a little bit tricky to see because it's a little oblique, but when you window this, you can see that there's some fractures through there. They're not complete, unfortunately. So and then again, some fractured ribs. When we looked at her thorax, we went through, again, this diffusely fairly lucent skeletal system. She has a sort of malformation of her sternobra, which I probably wouldn't have looked into too hard. We can see those quite as a consequence of lots of things. Sternobra can be quite variable. However, we do have fractures of her spinous processes in her caudal thoracic region. There's one complete fracture here and one complete fracture there. They're moderately remodeled. However, they haven't formed a big callus. Now, the reason they haven't formed a big callus is that they haven't got much strain on them, like ribs, I suppose. So these can sit in a reparative phase for a long time, the transverse processes. These ribs are trying to heal as well. So one rib fracture here, one here, one here. Otherwise, thorax, post-mortem, classic post-mortem thorax, heart, possibly a little bit of a straight caudal border on her heart there. Otherwise, fairly okay and normal looking at that level. But just a few sites where we've got some multiple fractures occurring in this case. And that's those spinous processes, and that's those ribs again here. Okay. So her summary, post-mortem after death radiographs revealed diminished bone density, and that's the big key here. Throughout the entire skeleton, she has a low body condition and multiple healing fractures, and old fractures in 2 of the spines of the backbone. These findings attributed to chronic disease states, including Cushing's, that were actively treated by the owner. So this wasn't an abuse situation. This was a case of a dog that had diminished bone quality from chronic disease, probably Cushing's related. Hi there.
Hi, I'm from Ontario, Canada, so I'm not sure how different things are, but does the veterinarian have to get owner approval?
Oh, I don't know. Rob, do you know?
Yes.
They did? Yeah.
They would have to.
They would have to, yeah.
They may not. That would be problematic if it went to court and they had diagnostics without them.
Even on a body that was submitted for cremation.
But it depends on, they may have relinquished the body for you for cremation and then it changes that.
Okay. Yeah. That makes sense. Does that mean? This is an interesting case, I thought, because the dog was there for disposal, but the veterinarian clearly was concerned that there was something more going on by the body condition of the dog, and took the liberty to take radiographs before they sent it to cremation. So I'm not sure what the legal standing of that was, but yeah. No, it's interesting. I thought it was an interesting case because that imaging really helped kind of identify that, okay, we don't have a normal bone here. We have a dog that's probably got chronic disease. She's old. There's a few other things, the fact that she had a history of pelvic limb issues, so maybe she's not walking around so much. We've got diminished bone density going on. So these all help push us towards a diagnosis that's leaning towards, okay, these fractures could have just happened spontaneously as a result of the bone quality rather than an abuse situation, which is helpful. Okay. Moving on to this little girl. So this is a senior black and brown Yorkshire Terrier. Owner reports limping on the front leg for 1 week. She's a little bit unkempt, isn't she? Clinical examination. Severe hair matting, limping in the right front leg, and she has a deep wound. in her lower limb, overgrown nails, and she was moderately dehydrated. So they decided to evaluate this area with radiograph to see what was going on and what this chronic wound looked like underneath. So this is the radiograph. What are your thoughts? Yeah. So this is a deviation in the soft tissues, exactly where this matted coat was lying. And then the bone underneath, as a result of this constriction, interestingly, has resorbed. And she's got now a pathological fracture of this bone as a result of that, and a completely demineralized bone. And the concern for that is she going to respond? If we dematted her and stabilize that, would that come back? And that's a question that is unclear. Distal limbs in Yorkshire Terriers are poorly vascularized, and they struggle to do well after fracture repair. So perhaps this won't grow back. So the option is, do we go in and amputate the digit at this level, or do we go in there and try and repair it? So she's got necrosis related, so vascular constriction and necrosis related, hypovascular related necrosis of that distal metacarpal bone here. And there's a small fragment here, and quite separated as a result of this constriction here. So imaging really helped identify the extent of that chronic wound, and showed that there was osseous, associated osseous lesion secondary to that chronic injury. So we see vascular-related bone resorptions secondary to fracture repairs, not infrequently in skinny limbed dogs. And we're seeing those, I would say, starting to occur between 3 and 4 weeks post-op. That's when we surgerize dogs like Italian Greyhounds with long, thin legs. We put plates on. Their limbs are just so poorly vascularized, and we often will see, particularly if we have a radius ulnar fracture, and the distal ulnar will just slowly get resolved because we've disrupted the vasculature too much with the surgery. So I would say this is weeks versus months. I would say we're looking in the, and it all depends on the degree of constriction, because clearly it's been there and gone slowly constricted down over time. So I would say we're looking at the sort of 3-week range of chronic obstruction to get that degree of demineralization. I think that's hard for you guys, because that was something when I was looking at these radiographs. So how can I give an accurate timeline on this? Because that's actually really helpful for you in the clinical case scenario, but also in a legal sense, is knowing how far away were these, how long ago did this happen in relation to all these other events. So that was something that I was trying to tussle with, and unfortunately we don't have any studies that say, okay, how quickly does this bone demineralization secondary to this specific injury? So it was something that I was trying to do when I was creating these lectures, but it seemed to be quite challenging to do. So her summary was: severe wound and resulting bone resorption and fracture was a result of chronic strangulation of the limb by hair. This occurred from a lack of proper grooming and excessive dense hair matting. So this again was a neglect case. She might have been, it's always hard that those scenarios where she might have been loved, but they just didn't groom her. I don't, or they just not looked after properly, unfortunately. It was interesting that they bring them to the vet to be looked after. So that's some side of the psychology behind it I found very interesting. Because they bring them to the vet to get fixed when they've chronically neglected a case for so long. It's very interesting, or abused a case for so long. That's true. Sometimes it's already bad. Yes, that's true. Okay, moving on to case 5. This is actually the dog that we're looking at now here. So 3-month-old Yorkshire Maltese Cross. Visit 1. So owner history: daughter playing with puppy and claimed puppy laid down and didn't get up. Has not been mobile for 3 days. It will not eat, drink, or stand. It's not a great situation for a puppy. Examination: she was laterally recumbent. Right hind limb was painful and she had some crepitus. The owner elected for no diagnostics or medication and took the dog home. So the owner was hopeful that the dog would get better on its own, is what it said. Is what it said. unfortunately, a few days later, about a week later, she was found by a Good Samaritan on the side of the road, tied in a bag, and brought in immediately. So they managed to link her. On the first visit, she had a different name to this, then they renamed her on the second visit, but they managed to link the case. So she obviously had they managed to make sure that this was a congruent case and it was the same dog that came in before. She was non-ambulatory, bruising, swelling over right stifle. She was also obtunded in her mentation. They suspected some head trauma. So we performed CT examination. So what we did as a CT, just because that's going to tell us the most information about the skull and cranium and fractures present, but also give us information as to if there's an underlying brain hemorrhage going on. So as we can see here, we've got this is the frontal bone, this is the top of the calvarium. We're slicing her dorsally like this. We have a thin, quite a thin bone in these little Maltese dogs. They have quite round heads. And we have this small fragment that's formed in the frontal bone here. It's not depressed in at this stage, it's just fractured, rather than it being a blow that's depressed the fracture in. I'll show you some more reconstructions and you can see the extent of it. Underlying it, we have this hyperdense material within the brain. That's brain hemorrhage. It's running along the falx, so the midline of the brain, extending down here, so it's subfalcine. And so she's definitely got some active hemorrhage going on in that brain. CTs are interesting in these Maltese round-headed dogs, Chihuahuas, Maltese, those sort of breeds, especially young ones. She's got an open fontanelle, which is normal. So looking at these skulls, and she has these suture lines, which are visible too, and that's normal. So detecting the difference between a suture line and a fracture is really important. And the big thing is to look where are normal suture lines running? They're usually bilateral, they're usually fairly symmetric, and they're usually in predictable areas between the bone plates. So this is frontal bone versus parietal bone. So that's perfect, that all fits. This is a midline suture line here. So that fits that these are suture lines. Open fontanelles, sometimes they never close. In the really dome-headed Chihuahuas and mini breeds, they sometimes never close. So just being aware that might be patent. And particularly she's a young dog, so she does have a patent fontanelle. This fracture here we can see running along over the frontal bone area and extending along her cranium laterally here. So we can see this. And she's got it's wider, it's got a bit of a step, there's a little bit of displacement. So those are all things that make us lean towards this is a true fracture rather than something that is normally within the bone, a normal bone fusing, which is what's happening up here. So quite a significant fracture going on here, quite extensive from a head trauma. She was charged and convicted of animal cruelty, and she's now living a happy life. And this is her Instagram account, if anyone wants to check her out. She's now named Pip. Moving on to an 8-month-old Siamese cat. Owners reported that she stopped eating and unable to walk from previous afternoon. On examination, she's unable to stand and painful when pelvic limbs were manipulated. And so radiographs were opted to take from. So this is her right forelimb. This is her shoulder joint. This is her humerus here, elbow. This is her two femurs, right and left. What are your thoughts? Lots of fractures, yeah, sure. And osteopenic? Yeah, I think so. Look at this cortex. Look how thin they are. They're kind of pencil thin. I mean, really, really fine pencil line thin, aren't they? And these fractures are interesting because they look like they're almost collapsed. Like this bone looks, rather than like snapped, it looks folded. And that's a classic folding fracture. And they'll happen, folding fractures really often happen around the metaphysis because that seems to be where the bone slightly angles. So this is a proximal metaphyseal folding fracture here. We've got a folding fracture on the distal femur bilaterally here and here. And then this is a complete fracture in the mid-diaphysis at this level here. So we have these multiple folding fractures. A spine is also not great. So she has these wedge-shaped vertebra, probably crush injuries as well, and this sort of sharp angulation, and we can see this sort of angled spine here as well. So she has these sort of bendy-looking vertebra, And again, diffuse the osteopenia. It's really hard to make out her spinous processes. She's got a very, very fine line of where the lamina should be. So really, really quite a distorted vertebral column. And then we can see those femoral fractures down here. Otherwise, has historically been eating, does have ingesta in her colon. Serosal detail is appropriate for a young cat. We can see a little bit of this is the renal margin here, so we can see the cranial pole of the left kidney there. And we are, seeing some fairly active ingesta going on. But big problem with the skeletal system. This is her skull. This is another way, if you're querying osteopenia, it's good if you get a skull radiograph, you can have a look and see what the dental opacity is compared to the adjacent bone. Because dental opacity is always set in stone and doesn't change, whereas bone opacity can vary. So dental opacity, in this case, she's obviously very young, but they look very opaque in relation to the mandible and maxilla. So she has those classic floating teeth going on as well. So definitely a diffuse osteopenia going on. So then we've got to start thinking down the road, okay, well, we do have a multi-fracture case here, but we also have a diffuse osteopenic patient. What do we want to be asking the owners? Yeah, exactly. So do we have a nutritional hyperparathyroidism going on here? And what we found is that the owner was feeding this kitten a normal commercial brand food and giving it an optimal diet. So this is probably, therefore, a genetic malformation in this kitten that's predisposed to this osteopenia. She's just not for some reason, able to regulate her calcium-phosphorus ratio appropriately to maintain skeletal mineralization. And so this was put down to the folding fractures, complete skeletal demineralization, were all put down to something that was not owner fault. And therefore, she was not considered an abuse case. Those guys can't, there's too many fractures. It's like those little dragons as well, the bearded dragons that have that nutritional hyperparathyroidism. You get to the stage where you're not going to be able to recover them. And that's extremely severe. That's a really extremely severe form of metabolic bone disease that kitten had. And those little dragons, they're actually the worst abuse cases we see. I think I always feel so sorry for them because they're, usually it's just ignorance and just not having a conscious thought about, owners are often have bought it for their 11-year-old child who, put it in and it's a bit cold and there's not quite enough UVB, and they end up with these really, really, really really abuse. Unfortunately, those folding fractures are extremely painful. So it's, as a fracture is. So really, really sad. Okay, moving on to this girl. So she's a 2-year-old female pit bull. There was a report that this dog was being kept in a closet and was malnourished, and she was brought in by the New York Police Department and she was picked up. On examination, they identified that she was underweight, she was mildly dehydrated, she had some facial asymmetry, and she had some broken teeth. But standing and active and able to ambulate normally. They decided to do radiographs, and then they followed that with CT. So here's her radiographs. I put a handy arrow to show you the in case you didn't notice this one. Yeah. So I would say, do you know what would you call that phase, do you think? Phase of healing? Yeah, probably remodeling. I think we've lost fracture line here. So remodeling phase, fracture, chronic. So we're leaning, at least a month old, if not longer. Probably a complete fracture at the time. Because of the degree, you can always presume there was a fragment here and a fragment here, and there's enough displacement that was complete. So, complete previous fracture of left humerus. What about this skull? Do you think we were thinking this guy? Yeah. We've got a little fragment here, haven't we? I thought that the top of the calvarium was a little ill-defined and looked a little sclerotic, and like there was some sort of smooth new bone formation happening. And so for me, that looked like a periostitis. second due to probably chronic, previous micro fractures on the head. And these guys have really good craniums. These bull terriers have, not like a Chihuahua or anything. They can, they don't fracture easily, these guys. So as a response to trauma, her periosteum's become angry, and Hannah's put down new bone, but she hasn't actually fractured from this. She has a fragment here, so she's probably chipped her calvarium at that level. But from this image, all I'm seeing is a periostitis dorsally. She also has chip fractures along her spinous processes here and here. Actually, there are multiple more. And she has rib fractures in reparative phase. Sorry, remodeling phase. No, you can't see the fracture line, so remodeling phase. 1, 2, and I think there are a couple more along here. Thorax-wise, normal. I thought that I couldn't see any contusion. She has, a bit of some bronchial markings, which I thought would be appropriate for a dog of this age and breed. Heart size is normal. Trachea is running normally along the middle here. Don't see any pneumothorax. Don't see any active trauma going on in the thorax at this level. Abdomen, more fractures of spinous processes. There's a chip here, another fracture here, another fracture here, another fracture here. She has a fractured vertebra at this level. It's sort of chipped off the bottom here. This is her end plate. You can see this little defect, and it's sort of displaced. These are her rib fractures here. Serosal detail is normal, which is great. She's a bit thin, and we can still see roughly spleen at this level, urinary bladder here, liver coming down, a nice image of gastric access. That's all appropriate. Splenic head, kidneys. So I can see her organs nicely. She clearly has eaten, but she doesn't have much in her stomach at this stage. A little bit in her stomach, not that much at this stage. So she's a dog that has multiple sites of trauma. She has evidence of multiple phases of trauma. So this is a spine fracture that's in reparative phase. We have fractures that are in remodeling phases and multiple sites. So our imaging confirmed that she had periostitis of the zygomatic and frontal bones. She had multiple chronic spinal fractures. She had rib fractures and a humeral fracture of variable ages. In total, she had 26 fractures resulting from multiple blunt force impacts. So this was a prosecution case. Hi.
Any sense of what sort of injuries cause dorsal spinous process?
Oh.
Like how it's such a protected area.
So it is. Remember, she's quite thin, so they're going to be sitting higher, and her ones, they're sitting right at that margin where she's got shoulder blade protecting these guys, and they're not there. So these are blows to the back, straight. Yeah. And when you do a CT of these guys, like the CT looks like this, the spinous process is sitting here, the muscles on either side kind of coming up, and they come to the tops. So I would say it's a blow to the dorsal aspect of the vertebral column. Yeah. So she was a prosecution case. That's us. Got through this well quicker than I expected.